BPH stands for Benign Prostatic Hypertrophy. It is a non-cancerous enlargement of the prostate and starts to affect men from 40 years of age. In fact, by 60 years of age, 60% of men will have some degree of enlargement. The prostate is a gland that sits below the bladder, and as it enlarges, it starts to obstruct the flow of urine. So men will often complain of symptoms like slow flow, some dribbling of the urine. They may have symptoms like urgency, frequency, and sometimes waking up at night to pass urine. Lastly, they may have a feeling that they cannot completely empty their bladder. There are a couple of options in terms of treatment for prostate enlargement. This can range from medications which have certain side effects and have to be taken in a lifelong manner, or another option, a surgical option, is transurethral resection of the prostate, where a small scope is passed up the urinary tract and the prostate is scraped from the inside out to create a nice open channel. This procedure, though, is associated with a small risk of bleeding, associated with sexual dysfunction, and rarely associated with urinary incontinence. Now there is a new method of treatment known as Rezum. Rezum uses natural energy stored in water vapor or steam to shrink enlarged prostates. During each 9-second treatment, sterile water vapor is released into the enlarged parts of the prostate. When the steam turns back to water, all the stored energy is released into the prostatic tissue, causing it to die. Over time, your body's natural healing process removes the dead cells. With the extra tissue removed, the urethra opens, reducing BPH symptoms. Most patients begin to experience improvement from as early as 2 weeks and have maximal benefit at 3 months. Rezum is a procedure that can be done as a day procedure. It doesn't require an overnight stay in a hospital. It also doesn't require general anesthesia and can be done under local anesthesia or sedation. And most patients return to normal activities within a few days of treatment. Studies have shown that this treatment is effective, but more importantly, it's not associated with incontinence and rarely associated with sexual dysfunction.